My name is Carole Herman, and I'm the founder and president of an advocacy organization called the Foundation Aiding the Elderly, and we use the acronym FATE. I formed this organization in 1982 after the death of my aunt in a nursing home here in California. So we work on a nationwide basis. Our main focus is the prevention of nursing home abuse. But since the Foundation Aiding the Elderly says so much, we will service anybody who calls the organization for help. Stolen properties, somebody being taken advantage of. But our main focus is the prevention of nursing home or long-term care facilities, abuse in those facilities. Well, the reason why I started the Foundation Aiding the Elderly is after a relative of mine died from poor care in a nursing home. I went to the regulatory boards at monitor nursing homes. They're the ones that are empowered to check on complaints, make sure that they're in compliance with federal and state nursing home regulations. So I took it upon myself to find out that system. Now we're going back to 1982 when nursing homes weren't really being looked at. Nobody was aware of the abuse or poor care that was going on in these facilities. So I found out who licensed nursing homes in the state of California, and I went to that particular office and asked to speak to the head of the department. And I had prepared a really thick, very well documented complaint on the care and subsequent death of my aunt in this nursing home, and asking that this agency go in and investigate what happened to her. And she died from infected bed sores, which we were appalled. We didn't even know what that was. And she was being drugged with psychotropic medications that we did not know. Nobody ever asked the family to give her those types of drugs. They just did it anyway. So after I filed that complaint with the state, I was stonewalled for almost a year. And after my secretary started logging all the calls that we would make to that office, and after about 85 phone calls with no return calls, I figured out that, one, there's problems in nursing homes, and there's also problems with the regulatory boards that are empowered to protect us all in that environment, and it wasn't working. So what happened was the Attorney General in the state got involved, and I sort of pushed the envelope on it. And there was an internal affairs investigation into the licensing board, and the head of this agency had destroyed my complaint. So being the businesswoman that I am, obviously I kept copies of everything. So when the investigators came to me and said, well, we can't find anything in the files on your complaint, I just handed them the package. And that particular person was fired from the state of California, which has made headlines across the state, front pages of newspapers. And there was some change that took place then. That was a 3-year process to complete. The person that lost his job, that was fired from employment in the state of California, was the man who I took the complaint to. He headed up the licensing office, and I took the complaint directly to him because I wanted to deal with the decision maker rather than just handing over a complaint. I wanted to make sure I spoke to the right person. And my complaint never went through the process. And they figured, well, if they can stonewall me, I'll eventually go away, like apparently they must have been doing to other people. Well, I didn't go away. It just fueled me to continue with this work, knowing that there was a problem not only in the nursing homes for poor care of our parents, but the agency empowered to protect us in that environment was a failure as well. And I had my suspicions that they were working in concert with the nursing home industry to protect the nursing home industry and not the patients or the family. So that's really how I started the Foundation Aiding the Elderly. It was just by poking around and looking into the system and finding out where the failures were. Well, my experience led me to believe that the nursing home industry was working in concert with the licensing agencies because, after this happened to my aunt, I started getting involved helping other families, and it seemed like they would file complaints or find out the regulatory board, and they would file a complaint or go through the ombudsman program and file a complaint. But nobody ever found out what happened. They would report a complaint, but they would never get the confirmation of the complaint, a complaint number. They never received any notification from the licensing office that the complaint had been investigated and what the results of that investigation were. And of course, most people don't know the process, so they just figure if they call up and issue a complaint, that the state takes care of that, and it slaps their hands and they get fined, and they won't do that. The nursing home will not break that law again, and that in fact is not what's happening.
Who are the people in what agencies, overseen by whom? If you can take us down that trail.
In 1965, Medicare decided that they would pay for nursing care for Medicare recipients. So in 1965, Medicare passed the law that there would be financial support for nursing homes. Well, along with that came the regulatory boards and who was going to monitor them. Well, at the federal level it's HCFA, Healthcare Financing Administration. Then on the state level, it goes to the Department of Health Services. And each state has maybe a little different name, Health and Human Services, but in most of them are Department of Health Services. So within that agency, there is the Licensing and Certification Division. Now that division is the one responsible for operators that come in and fill out applications to become operators. They are the ones that approve an operator to do business in the state as an operator, healthcare operator. Then they also have the responsibility of annual inspections for recertification, because their licenses are on a yearly basis. So they have to go in and investigate them and make sure that they're up to code in order for them to renew their license, and then they pay a fee. And also within that umbrella, under the licensing and certification, they are responsible for investigating any types of complaints that are filed, whether it's from a family member, through the ombudsman program, advocacy organization, and then under the federal law, and a lot of states have their own laws as well that are different from the federal government, so they usually use whichever one is the strongest law. They have a time period to accomplish that, 10 days to open up an investigation into a complaint, unless they prioritize it as a priority 1, which is imminent danger for that patient. Then they have to, within 24 hours, open up an investigation. Then under the federal code is you have 45 days to complete that investigation and do the report. So it's a big responsibility, and this is basically our monitoring of nursing homes, and whether or not the operators and the people that are working in these facilities are really living up to federal regulations, state regulations, and whether or not our parents and our loved ones are getting proper care. So that is the process. Under the umbrella of the Department of Health Services, you've got these different agencies. So you go to one place to apply for an application, but it's still under the Department of Health Services licensing and certification. You go and you apply for a license to be a long-term care skilled operator. So that's where you apply. And then you go through the process, and you have to put up financial statements and all that. That same agency, under that same umbrella of the Department of Health Services, is also the one that monitors that nursing home to make sure that it is in compliance with federal and state nursing home regulations, and that our parents and loved ones are not being abused and being provided poor care in that facility. So they're the regulators as well.
It's like the fox guarding the hen house.
Right. This particular monitoring system is also fragmented, because you've got DHS, Department of Health Services licensing office that oversees the actual operator and the operations. But then you've got the medical doctors that come in here, into the facilities, that are they're monitored and overseen by the board of the medical board. Then you've got registered nurses they have to report to the nursing board. So you've got a fragmentation in this. There's not just one agency that you go to that oversees everybody. But the main agency that to ensure the protection of our parents is the Department of Health Services. They're the main one. When they find problems, they're also mandated to report that to the medical board, the nursing board, or any other boards where you've got licensed workers that is not under their umbrella. So if they find problems, they're supposed to report that.
Are there two different categories